nothing to sneeze at. Next, On Call with the Prairie Doc. Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support On Call television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, an organization working with the state's healthcare community to improve quality of care as part of the Great Plains Quality Innovation Network. Additional funding is provided by Aberdeen Asthma and Allergy, Avera Heart Hospital, Brookings Health System, Dakota Allergy and Asthma, Dakota Care, Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, South Dakota State Medical Association, Swiftel Communications, and Vance Thompson Vision. Closed captioning for On Call with the Prairie Doc is provided by Avera, Brookings Health System, and Fishback Financial Corporation. We spend most of winter looking forward to spring, but then plants begin to bloom and our noses begin to run, and climate change is making it worse. Springtime allergies, tonight On Call with the Prairie Doc.
Good evening and welcome to On Call with the Prairie Doc. Allergic symptoms can be anything from hives or rash following an antibiotic, an upset stomach after certain foods, a runny nose and scratchy eyes in the spring, to a dangerous drop of blood pressure from a bee sting or a peanut butter sandwich. Allergy problems have resulted in a subspecialty where the expert understands not only what can cause these annoying and dangerous symptoms, but knows how best to identify them and treat them. First, let's take a look at this week's Prairie Doc quiz question. One ragweed plant can produce how many pollen grains in a season? A, 100, B, 5,000, C, 1 million, D, 1 billion. Viewers who call in the correct answer will be entered into a drawing to win a signed copy of our book, The Picture of Health. Each of my essays, originally written for this show, comes with a wonderful accompanying photograph by Dr. Judith Peterson. We'll announce the answer and the winner at the end of the show. Remember, you only have 10 minutes to get your answer in, but you have the whole show to call in any question tonight about allergy. We answer your medical questions about allergies as they are called in or sent to us via Facebook or email. Call in questions to 1-888-376-6225 or send us an email to the address on the screen, and you can throw in the question answer at the same time. Returning to help us understand this complicated field and to answer your questions about allergy is Dr. Mark Bubak, MD, internist, and allergist. Thanks for joining us, Mark.
More than happy to.
The specific question about allergy that's been making my head scratch, not to mention my eyes and nose, Dr. Bubak, is how different people seem to be with regard to allergy. Some are so sensitized to every darn thing in the universe, and some are not bothered by anything, or only by this one thing or that thing. Are we really that different? And why is there such a difference?
Humans are fun, and boy, we are different.
We are different, aren't we?
You know, probably 80% of people don't have an allergy at all. And so it's just it's the minority, and it has to do with how we react to our environment. And there are substances called interleukins that in some people are genetically programmed to make an allergy. And then there are things we do, like we don't feed our kids peanut butter until they're 2 years of age, and they get the peanut butter on their skin instead of down their GI tract, and it leans them towards the allergy stuff. So it's fun to see what we can do to change that.
So it's genetics and it's environment.
And the combo, and even when we get an infection at a certain point in our life, can make a big difference.
Different kinds of infection.
So, the kids who get their RSV when they're real little, it seems like there's something that makes those people more likely to go down the asthma pathway. Whereas if you get like good bacterial pneumonia, those people are more likely not to get allergies. Of course, they may also die from their pneumonia. So there's some benefits of not getting the bad infection.
They said that all of these autoimmune allergic things have been on the rise, more asthma, all of this, while the deaths from infections and sanitation issues have gone down in humankind. Does that correlate?
That's the hygiene hypothesis.
Yeah,
and there's some correlations. It's not 100%. So, these days now we're, as allergists, talking about interventions. So the big thing is feeding your children peanut butter and egg starting at about age 4 months of age. And we're thinking that it's going to cut the incidence of peanut and egg allergy by half.
Really, just by feeding them that early?
Feeding early. And if you have a mild allergy or an allergy at 4 months of age, it's going to show up as a little bit of hives or a real mild reaction rather than later on where it's a lot more dramatic.
Would it desensitize them, you think? I mean,
no,
but you'll see it. And
what's happening is that by eating the food, our GI tract is set up to tolerate things. That's how we get our nutrition. So if you want to not be allergic, have the first exposures through the GI tract rather than on our skin, which is more likely to get allergy.
Well, that's very interesting.
So that's the big new thrust now.
Is GI tract
expose people young so that they get tolerance.
So that leads me in the direction of the book that you wrote just recently. You just came out with a book on eosinophilic esophagitis. Now that's generally a GI tract kind of a gastroenterologist territory. And so you're an allergist, but you've done this book. Tell me what got you into that, and does that have anything to do with what you just said about GI exposure?
The eosinophilic esophagitis is like having terrible reflux that the meds don't help. There are these white blood cells called eosinophils in there. Food gets caught, a lot of throwing up, things like that. And it's been found that a food or a couple of foods that you eat are usually what causes it. We don't know why a person all of a sudden becomes sensitized, but our book gives a month of dietary suggestions to keep you off of milk, egg, wheat, soy, peanuts and tree nuts, and fish and shellfish. And at the end of the month or two, your symptoms should be all gone if being off those foods is going to fix you up.
So what is it again? It was shellfish, peanuts, milk,
egg, wheat.
Okay.
So there's 6 food families.
All right.
And it works.
So the eosinophilic allergy goes away, or the esophagitis goes away.
And then we start adding back foods, and it comes out that it's 1, 2, or 3 of those foods for most people.
And then they can, so I mean, what's been done so far was steroid nasal sprays, but you swallow it. That's the treatment.
That'd be the big thing, and then real high dose proton pump inhibitors, so high dose
Prilosec.
Yep, 40 to 80 milligrams a day.
Right, but then hopefully you can get off of those things.
Yeah, get off the meds. Be a lot better since people have this disease their whole life.
So they're going to be allergic to one of those things. Finding it is interesting. So, okay, right now, this is the hot time for an allergist to be on our show because it's so allergic right now. It's the tree allergy season.
This is tree season, and this year is tough. I thought last year was kind of a bump, but boy, people are just miserable. The itchy red eyes, sneezing fits, plugged up nose. It's rough.
Snoring at night, as my wife points out. I mean, I can't get my airway to open right, and so I'm snorting and snoring at night and miserable.
It's kind of a neat year, though. Allergy treatment has changed in the last year. Most everything is over the counter. And so if you kind of watch your symptoms, say, okay, every April and May I'm terrible, or every August, you can start up. And if you know that a Claritin fixes you, that's all you need. But most people with allergy, it's worse. And the nasal steroids are the big thing. And so a week or two before you know your season's going to start, you start your nose spray. Take it all the way through the season, every day. And remember, the squirt today is more so for about a week or so from now.
Now, we have an animation showing how to spray. What is the correct way to use a nasal spray?
It's every day.
Okay, and you lean forward?
We lean forward, kind of bend over, aim kind of at the inside of the eyeball on the same side, squirt 1 or 2 times. You don't have to sniff in at all. And the material just kind of drips down the back a little bit. It's coated the inside of your nose.
Right.
And then you run off and have fun for the day.
So do you spray outwards toward the outside or inwards toward the septum or right up the middle?
This is your left side.
Right.
And so you're aiming the spray to hit these turbinates.
Right.
And so that's outward. And if you squirt the middle of your nose, it's the septum, and you'll get a higher instance of nosebleeds.
So you want to go more outward.
Outward, yeah.
And you want to lean forward.
That's the best.
And you don't need to sniff.
It's a lot better if you don't, because then you don't have that dripping in the back of your throat.
And you think that the steroid sprays are better than the antihistamine pills?
It works about twice as well. If congestion's an issue, you have to go to the nose spray with the steroid in.
So let's show the different kinds of nasal sprays that are over the counter. There's two of them here.
There are actually 3. There's the Nasacort and the Flonase and Rhinocort. Just last couple of months came out.
So these are all pretty equal.
Yep.
And they're about the same price, 12
Someplace
to
$15 or so, and for a month's supply.
$15 for a month's supply, and you do 2 sprays once a day, each nostril.
It's 1 or 2 squirts, yep. And then you add your Zyrtec or Claritin on top, and some eye drops like Alcon or Zatador or whichever you like.
And those are over the counter too?
Over the counter. If those aren't working, your doc will end up giving you a little prednisone, and quite often you'll end up doing allergy shots. And they can really help out. It's been kind of neat, about a year or so ago, under the tongue treatment came out, and it was finally a dose that was found to be effective in a lot of people. And so you put a tab of ragweed under your tongue each day, or a tab of grass. And if you're just allergic to the one thing, boy, it can make a difference. If you're allergic to more than one, the shots are a lot more economical. The neat thing about the tabs is you can do it at home. The bad thing is that historically, only 20% of people complete a course of
the
that.
tabs.
Whereas with shots, about 75% of people make the full 3 years, and most people want to do 5.
Right. So, I mean, would you do that kind of shot therapy or the tabs, whichever? You got to know what you're allergic to, though, to do the tab. Would you do that all year round for a guy who has 2 weeks of problems in the springtime?
If you have 2 horrible weeks and your meds don't work and you can't get by, one could do that. And it would have a high likelihood of really helping out and making you way less allergic. You stop the treatment after the 5 years and you keep doing well, is what we find most folks.
Wow.
I truthfully say there's the longer the season, the more likely you're going to want to do the shots. If you have 2 weeks, some of us would just say, I'm not sure I really want to, I'll be honest.
Yeah. Right.
But if you have August and September and October, despite all the meds and you can't breathe, you can't sleep, it could be life-saving.
Yeah, make your wife happy.
Yeah,
anyway.
that's what I meant.
Yeah, life-saving. Living things are divided first into 2 kingdoms, plants and animals. Sometimes the plant kingdom causes distress and discomfort for the animal kingdom.
Well, just about every plant is going to produce a flower at some point in its life. Some might not do it right away. There can be a juvenility period in many kinds of plants. But in general, most adult trees, shrubs, flowers, plants, they are going to flower at some point, and they will generally produce pollen. And that pollen, depending on the kinds of plants, is in some cases more readily blown around by the wind. In some cases it's not very much blown around by the wind. It might be very sticky and not move around except by insects and so forth touching it. But when we talk about trees, they're up in the air. We have a lot of wind in South Dakota, so it's very easy for many kinds of tree species for that wind to pick up that pollen and move that all over the place. So if you go outside and you happen to be allergic to that particular kind of pollen, it may affect you. Well, goldenrod is a kind of a late summer flowering plant. People see it, sometimes they just see it and they already think their nose starts running and their eyes are watering. It's like, oh, that goldenrod is terrible, it's causing all this hay fever for me. But goldenrod has a very sticky kind of pollen. It's very attractive to insects that like to eat that pollen, but it doesn't blow around. However, at the same time, ragweed, which is probably one of the worst pollen-producing plants that we see, and there is a lot of it out there in the landscape and out in the countryside, that pollen is very light, flies around in the air very easily. So even though goldenrod, that's what's causing my problems, it's really the ragweed that's growing down below that people might not even notice, and they're walking through it. Goldenrod gets a bad rap, but it just happens to be the showy plant when the ragweed is down there below causing the real problem. It's not just plant pollen. You can also have spores from fungi and molds, especially after the snow melts and you've got dead grass, you've got dead leaves, and if it's a wet spring in particular, those things can start feeding on that decaying material. They release spores, those spores get up into the air, and that can also cause an allergic reaction for some people. So it's not just tree pollen or plant pollen, it can also be spores from other kinds of organisms. If you have problems, check with an allergist, watch your local television shows. They often will give you what the pollen counts and what the allergy probabilities are, and that can give you some better idea as to if you're going to be suffering from one thing or another. And once you find out what you're allergic to, that's going to be a better idea of, okay, I've got to really watch it the first part of June because that's when this plant is in bloom. Might want to stay indoors more frequently or use some of that allergy medicine.
David Draper was a guest on our Prairie Doc radio program yesterday, and he had some really great advice and information. If you want to find out more about plants, allergies, etc., we have the radio show on our website, prairiedoc.org. Mark, have you noticed changes in the timing of spring allergies over the years? I mean, they say that there's something that something's happening with our global warming or with, tell me your opinion on all of that.
Yeah, there's a lot of talk with the allergists about the global warming, and it may have an effect on pollination, and a lot of research is actually ongoing, and I can't tell you the full effect, but boy, I never thought of tree season so much in March as we had this year. People just really kicked in hard.
So this has been a heavy tree season, pollen season, more than usual.
We're a prairie state. We're normally a grass heavy.
Right. Boy, there's been a lot of tree stuff.
Yep.
Okay, I've got, see if you can,
questions
I'll trade you a question machine. This one isn't working for me. 82-year-old man from Frederick, South Dakota asks, I have dry mouth and eyes. Could this be due to allergies? Dry mouth.
A dry mouth, it could be from allergies if your nose is so plugged up you can't breathe through it and your mouth breathing. But the combination with dry eyes, it probably is not allergy. It'd be one of the Zika syndromes.
But I noticed that this...
Or meds.
Or the meds. This season, I had this huge stuffiness, but my mouth was dry, and I think that was really mouth breathing.
Mouth breathing stuff. With allergies, you want watery eyes, and then a little kind of red in the whites of the eyes.
The differential would be a viral respiratory infection.
Yeah.
And what else would come with virus that's
usually it could be one eye or two, but it kind of feel more gravelly.
Okay.
And not a lot of nose symptoms, and the sneezing fits isn't there with the virus. The hay fever from trees and stuff.
That's
and
sneezing.
It itches crazy, and that scratchy, itchy back between your ears at the roof of your mouth.
And
that's
then
pollen
sneezing.
Allergy.
Yeah. Okay, that's it. That's what I've got. 65-year-old woman. I want you to know I was using the nasal quart steroid nasal spray. It made a lot of difference. It lubricated things too, so I could sleep better. 65-year-old woman from Sioux Falls asked, about 30 years ago, developed a peanut and egg allergy as an adult. Why does this happen in adulthood?
Bad luck, I suppose, would be about as best we can say. We don't know why people all of a sudden do it. It's interesting in gals, they like to get allergy later than guys do. And so the little boys, and then by the time we're 70, everybody catches up.
So the guys are worse, and little boys. So it isn't testosterone at all.
No.
What the heck is the reason?
We don't know yet.
Are we playing outside more?
No, that actually would make you less likely to have allergies. So farmers have fewer allergies than city dwellers do.
Because of hygiene theory again, right?
Correct.
You're exposed to all that dirt.
That's the idea.
Woman from Pierre asks, tenderness, red bumps and scales on the hands. Do you think this is allergy? What's causing it and what can be done? Tenderness, red bumps.
Tender isn't as often the allergy. We like to hear itchy, 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 itchy. And so it could be, but it could just be a regular hand eczema. That's a different kind of allergy than, say, the hay fever. Those are IgE, and the
Right.
hand stuff often is a contact dermatitis, more in the poison ivy category.
Dyshydrotic eczema is something that I've seen a lot. You know, little blisters and lots of bumps on the hands, and you think that's more contact, something allergic that you're touching.
No, usually that one is just a condition you have. And then they seem to get other allergy or an allergy on top of it because the skin's open and is exposed to things, and they use a lot of stuff on their hands.
That's doctor talk, though. That's a condition you have. In other words, we don't know why the heck you have it. You just have it.
Yeah, dyshydrotic eczema is just one of those rashes that you get on your hands and feet. Yeah, I like that. Be honest.
I don't know what that is. A 32-year-old man from Yankton asks, I had pneumonia in high school and developed an allergy to penicillin at the time. I raised my own beef to avoid penicillin, but when I eat out and get steak, I don't feel well. Is that an allergic reaction to antibiotics given the cattle that I'm feeding? And also, I take some kind of Shazandra, I don't know what that is, to help with symptoms, heavy congestion. What are your thoughts about that drug? Thizandra.
Don't know what
Never
that
heard
is.
of it. I don't know what it is. But what about antibiotics in the chickens and the turkeys and the beef and the cattle and the pork? I mean, I think there is something to that, that antibiotics in them will give people problems.
Well, there's a lot of regulation as to how soon before slaughter you can even have that and how many of them get through. For a long time, chronic urticaria or chronic hives was thought to be perhaps from that.
Right.
And it's been found that the chronic urticaria people actually have autoantibodies against part of their skin rather than being allergic to the penicillin and such. So a person who you raise that question to, if you were a kid, you had breakout with infection, you thought it was from the antibiotic, there is testing for penicillin now, and a lot of people will have outgrown that. And so is it really the antibiotic? Because that's not a major problem that you see clinically. There's a lot more other GI disorders or gallbladder things from that kind of a meal that's going to be far more likely.
Right now, and you heard that I was kind of supportive of this gentleman who was worried about antibiotics in animals. I've said that to veterinarians and to farm people and SDSU cattle people, and they've poo-pooed it. They don't think, as you have, it isn't that big of a deal.
It's rare.
But it can occur.
That was a question that I answered this week in a patient.
Right.
And I think the bigger thing is antibiotics with animals is resistance.
To the antibiotics.
To the antibiotics, so that when we get sick with something and the bacteria from the cow, which we got into us, and it transferred the resistant gene, and now we can't get saved from our pneumonia. That's the bigger concern.
That's a bigger concern.
Yeah.
But this man may truly be very sensitive in antibiotic, and it could be a problem with him. What about the strips on the nose for people who have congestion? What are they called? The breathe right.
Breathe right type of thing. It just kind of opens things up. It can be helpful. It's a non-medicated way and can be quite helpful. They have actually ENT procedures that do something like that, where you kind of shrink the inside of the nose if the congestion's big. But boy, it's easy to put those on.
Yeah, it's easier than a surgical procedure. So you were talking about urticaria, which is hives.
Hives.
Let's talk a little bit about that, because a lot of people say, oh, well, I'm just allergic to this, and then I have hives, I'm allergic to that, and I have hives. Is it different than the rest of the allergies?
Actually, hives is just a release of histamine from your mast cells. Allergy is one of many causes of releasing that histamine. So if you have a food allergy, as part of your anaphylactic reaction, you'll have hives. And it's really rare that you would ever get only hives from a food allergy. You should get some throat swelling, nausea or vomiting,
GI
short of
symptoms.
breath, all at the same time that you're getting the hives. If you spread the peanut butter on your skin, you're going to get hives there. That's a contact type of hives.
Okay.
The dog licking you.
Right. But now chronic urticaria is another bird altogether, correct?
Yep.
Explain that just a little bit.
Before I do that, let me also say that inhaled allergies, so like grass and ragweed stuff,
Right.
you have to have a horrible stuffy nose before you're going to get any hives from contact from that. So that's really a thing. Chronic urticaria, like you were asking, is a whole different boat. It's almost never from an allergy. It's an autoimmune disease for almost everybody where they have antibodies attacking the mast cells in your skin.
And would that be like lupus or rheumatoid arthritis? Or
For some of the folks, actually, it is. It's very similar to that and can be a spin-off or precursor. Most people with chronic hives, it's 2 years.
Right, right. So a lot of people will have, when they're having hives or when they're having a severe allergic reaction, their airway will close off. And they're
Anaphylaxis.
Yes. And they're in big time trouble. I mean, I have a friend who when we go sailing he takes his EpiPen with him, and that's an important treatment. Any comments about people who've had anaphylaxis, the EpiPen, and we have a video that we could use to show that. Any comments about EpiPens?
Epinephrine can be life-saving, and if you or your loved one starting to have a reaction, the faster you can get that in, the more likely you are to save somebody.
And it's not a major thing to...
Just a little teeny shot goes into you, gives it automatically.
Okay.
It's easy.
Let's look at the video. So we're going to do an actual demonstration. This is not a practice pen, this is a real pen. I'm not having an allergic reaction, but I'm not afraid of it because I know I've got good guys to protect me, but it's a safe thing to do even if you didn't need it, right?
Exactly. I mean, this is a wonderful demonstration.
So we should not be afraid to use it if we think we might need it. How would you might need it?
If your throat's swelling, you're itching, hard to breathe, feel like you're going to throw up, any of those things are signs of an anaphylactic reaction.
Particularly if you know that you've had a previous reaction, or you know you've been stung and you know that there's something, I call it the feeling of impending doom, and you should do something.
Something to do. So I'm having that impending doom. I was just bitten by a wasp, stung by a wasp, or I just ate a peanut and I'm in trouble, and I know that if I do this, it's not going to put me at risk, and if I don't do this, it's going to put me at great risk. So I want to do this. So this is the EpiPen. There's another product. They're both the same, right?
Yep. Right. They'll do the same thing. They'll save your life.
Quickly, within a couple of minutes, help turn that allergic reaction around.
All right, and then you get to the emergency room.
Yes, you do.
All right, so this is a real pen. I'm going to take it off the top, and I'm going to
Take it out of the protective case.
All right.
Get rid of that.
Throw that.
The
and
blue
then
pin comes out.
the cover comes off.
Throw it away.
All right.
It's fully armed.
Fully armed, now we're ready.
You ready?
Put it on your thigh.
I put it on my thigh through my clothes.
Yep.
Through your clothes.
And then I'm going to push it in.
And hold it for 10 seconds. There you go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Awesome.
Pull it.
I could feel it.
Way to go.
It hurt a little. Not bad.
Not much.
No, it's just a surprise because
And in a minute or so here, you're going to feel that your heart starts beating fast.
Okay.
And you feel a little jittery, like you just got scared at the movie theater.
or had way too much coffee.
Or I was going to give a trumpet solo.
The swollen throat, the itchiness is going to start receding, and you'll be feeling a lot better, and you can make your way to medical care now.
Very good. That's great. Thank you for providing us a pen and for being here.
Well, thank you
Two wonderful allergists.
for actually demonstrating it. That was awesome.
Nice.
Great. Thank you. Thanks for listening. Stay healthy out there, people. Well, I was a little jittery after that, but it wasn't life-threatening, no big deal. And if that had been a possible, maybe even a slightly possible chance, then it's better to do it.
Yep.
Take home.
If you think you need it, you probably should have already given it.
So get that EpiPen if there's a potential chance of a problem. So we've got, in any other scenario, if you got asthma, would you do an EpiPen usually?
Usually not. It's for anaphylaxis.
Okay, so people who've had problems with it. We have a caller from Brookings. My child is wheezing on occasion. Is this asthma? What about asthma? Let's talk about asthma.
Asthma is one of those common childhood illnesses that can go on into adulthood, the rest of your life. We've got little pictures here with the airways. It's the bronchial tubes that are an issue. And I don't know if this is on there yet. Nope. Okay.
Oh, there we go.
So we go. So on this side, we've got the bronchial normals, and the tubes are wide open. The muscles here are relaxed. Where on the other side, we've got the squeezing that's happening. It's like someone's getting just scrunched. And you get recurrent episodes of that. We get coughing, wheeze, tight chest. Infections with viruses are probably the most common thing for kids. If you've got some numerous episodes where they have some wheezing, coughing going on for a few days, and you do that 3-4 times, a lot of those kids have asthma. And depending how frequent it is, there's great preventative strategies. We've got the albuterol to take if you've got symptoms for quick relief.
Now the shots, let's say you're allergic to something and that brings on the allergies. Do the shots make a difference for asthma in children?
In little kids, say less than 5, the amount of problem that they have with viruses is so astronomical that you can't see as much help with allergy shots. Even in the real allergic ones, the studies were interesting because if you have some good nurses once or twice a week teaching the parents how to take care of their kids' asthma, that was probably the biggest thing that the intervention had.
Do you find that shots help any group? Because as adults, asthma becomes less responsive as an allergic process. Am I right on that?
Well, it depends. About 70% of asthmatics have a huge role of allergy. And if you're looking at somebody that's got their allergy testing correlates with when their asthma is bad, those people do really well. They're able to use far less medication. They have less flare-ups. They're not going to the ER and all that stuff. So it's an adjunctive care that you do along with other things.
Anything about asthma, you talk about all of the adjunctive care, but is it medication?
Usually it's meds. So sometimes you can do some avoidances, but it's hard. The inhaled corticosteroids are the main thing that saves lives.
Right, so what are examples
of
that? So
it'd be Flovent, Qvar, Asmanex, or Pulmicort.
Right, now there's a lot of medicines that are combined with the beta agonists. So there's steroids and a beta agonist. I kind of tend to go to that one because that keeps the patient taking the medicine. What's your take on the combination drug?
If you want a med that's likely to work, you'd go right to that.
Right.
The problem is that it is twice as expensive, so $250, $300 a canister for one of those.
Advair,
Dulera, Symbicort, Brio, and they work quite nicely. And so if you've got rather significant asthma, which is 1/4 of the patients have severe asthma, and, it makes a huge life-saving difference.
I generally get them stable on those and then try to move toward the
single agent
or the single steroid.
Single inhaled steroid. So you step down is what that is. And most people actually, once they get under control, that will happen. You'll be able to get it to them.
Right. We have a question from Alistair, South Dakota, 31-year-old man. What is the earliest age a child can get diagnosed with allergies?
I suppose even by a month. The allergies in kids are going to mostly be foods. So it'd be like milk or the soy that they might be getting as their formula.
People really get true milk allergies. That's different than milk intolerance as an adult. So explain that just a little bit.
So the milk is actually a fun substance. It's delicious in ice cream cones and chocolate milk and things. So when I say allergy, it's, you're going to break out in hives, your throat's swelling up, you're throwing up, you can't breathe. And so that can happen real early. What's real common too is you have milk intolerance or milk soy intolerance as a baby, and you get bloody diarrhea, terrible abdominal pain, bloating, and the kids have to go off of it. It is not an allergy with that IgE antibody.
Right.
And then there's also lactose intolerance from milk. It's the sugar molecule.
Right, which most adults kind of get into. A lot of adults.
If you're not Norwegian.
If you're not, Norwegians do fine. Desensitizing therapy may be the way to go, especially for year-round allergies.
Well, I first found out, I was pretty young, probably 5 or 6. My sister had a dog, and I was playing with him out in the grass. And originally, we thought that I was allergic to grass, but then after some further testing, found out it was actually the dog that I was allergic to. At first, it was a blood test with my family doctor that I had done that recognized some allergies. We kind of went with that for a while. Eventually, I went back to Dr. Bubak, and we did some skin testing. Originally, I started out with medications, but that was before I had a dog. When I knew I was going to get one, I started allergy shots before that. Even when I was just on medication, so my sisters always had dogs, and there's some families had dogs too, and it was tough to be around them. The way I understand it, there's a few different options. I did a little bit quicker option, so I'd go in and get 3 shots a day a couple times a week for a while until I got built up closer to my maintenance. And now that I'm on my maintenance schedule, it's once a month I go in and get a shot, so it's not nearly as much anymore. So the further you get out from the start, the less you have to do. Now I don't necessarily do anything special. If I know I'm going to go to a place that has maybe more cats or dogs or something, I might take a Zyrtec beforehand. But other than that, I don't have to do much for it anymore. As prior, I would have tried to avoid them completely, and if not, I'd definitely be on Zyrtec, Benadryl, Flonase, everything you could possibly do and still have uncontrolled symptoms. So, ever since I started allergy shots, my allergies have been much improved with the dog. On occasion, I still have to do some Flonase or some Zyrtec, but overall, the shots have done a great job. If immunotherapy is an option, it's worked great for me. I get asked all the time how much my symptoms have improved, and my guess would be 95% or better. So I recommend shots to who can ever have them.
So he had desensitization shots. In other words, he's allergic to dog. So we got a little dog, a little higher dog, a little more dog. Is the dog dander, or is the saliva, or what is it, the dog?
It's a little bit of all of that for dogs. It's mainly dander, and with each allergy thing, be it dog or cat or ragweed, there's a certain dose you need to get people to. And so we build them up to that. It's usually about 10,000-fold stronger than when we start. And by getting up to that high dose, you're actually able to retrain the immune system so that it just tolerates it a lot more. You don't cure them, but you get a marked decrease in symptoms.
So the antibody, an IgG antibody, gloms on before the IgE. That's the theory. That was the old thing that I learned 30 years ago. Is that still the case?
You can actually see the IgG, like goat, antibody elevating. We're not sure that it's really blocking. It's probably more with the T cells.
And they say, hey, we're used to it now. Not a big deal.
Not a big deal.
We've got a caller from Redfield with a related question. I think my 3-year-old child has allergies to cats, and we own and love 3 house cats. What can we do?
I think Grandma might need some cats.
Grandma needs cats.
Yeah.
You'd say get rid of the cats.
So
I mean,
that's the best thing. Clean everything up. That's in a perfect world. I'll be honest with you. Most people who have 3 cats love cats, and 3-year-olds you're going to be treating with medication for a while. Occasionally would contemplate allergy shots, but most of the time you're going to do shots when they're older, 8 or something like that.
So you don't want to start the shots before 8, and so you really need to...
You can, but say like by 5.5 to 7, most kids are so needle phobic you can't do it. So a 3 or 4-year-old that can talk and tell you if they're reacting, you could consider it, but...
Get rid of the cat. Grandma needs the cats. 21-year-old, that's a sad answer, but it's really the truth, isn't it? 21-year-old from Sergeant Bluff, Iowa, asked, and hello, Sergeant Bluff. what are some preventive measures we can take to help with springtime allergies? So, I mean, we've talked about it, but just hit it again. If I get allergic middle of April every year.
Number one, it's getting nice out. Don't open your windows. Keep the doors and windows closed. You won't get as much of the pollen inside. If we know that you got the tree season, say March 15th on your smartphone, start my Rhinocort and do it for the next 2 months. Those are the two big things.
Really, so close the windows, turn on the AC when you need to, and start yourself on steroids a week or two.
The nasal steroid spray 2 weeks before it would start up. It's going to be the best for you.
It's not hard. You can do it without going to the doctor.
Yeah.
There it is.
Just need to know.
Caller from Volga, my child has terrible eczema. Is he more likely to have problems with airborne allergies? Now, eczema is a complicated story. It's sort of like chronic urticaria, is it not?
Both are itchy. So eczema is in the same triad of genetic problem as asthma, allergy nose, and then the eczema. And so if you've got eczema, you are more likely to get hay fever and asthma than other people are.
And eczema, how would I know I have eczema? What's it?
It'll be thickened skin that's real scratchy. In a little kid, it's going to be more on the head and the lower legs. But then as we get older, it starts doing the creases and our
Creases
wrists,
here,
our
creases.
elbows, the back of the knees is characteristic distribution.
And so the treatment again is topical steroids.
Big thing is that after your bath or shower, you have 3 minutes and you have to put a good thick moisturizer on. And you put moisturizer on a second time a day. And that's the underlying most important part.
Before 3 or 4 minutes is done after you've dried off, you put the moisturizer, particularly those areas like CeraVe, for example.
Correct.
CeraVe cream is even better than CeraVe lotion, which is wonderful stuff.
Yeah, and you put whatever your favorite is. I always tell the moms of the little boys, just don't have them smell like a girl.
Yeah. So the ceramide, there's a lot of other agents that have the ceramide. That's the active agent. You can see it in the CeraVe, but look at it's CERA, capital VE, but there are other versions that have the ceramide. So we have a 40-year-old woman from Minnow, South Dakota, asks, is angioedema an allergic reaction? What is angioedema, Mark?
Angioedema is the thick swelling. So it's going to be deeper in the skin than the mosquito bite hive type of thing. And it's caused by bradykinin is the substance. And occasionally it's part of an allergic reaction. Those angioedemas are going to itch. The other ones that are more common actually don't itch. So a blood pressure medicine that's an ACE inhibitor like lisinopril is probably going to be the most common cause that we'll ever see. And there's some familial disorders where people will do that. And
how do you differentiate angioedema from urticaria, for example?
So the hive, we like to see it come and go. It's real itchy. It's for sure it's not going to last 24 hours.
Right.
Angioedema typically will be a lot deeper. It usually feels woody, kind of like you had your Novocaine, and it often lasts up to 2 days.
Okay.
It's not going to last more than 3 days. That's not, if you get that'll be something else if that happens.
But it's mostly an allergic reaction.
It's mostly not.
Oh, it's not. So what do you do to?
It's often not, and it's caused by other mechanisms. And if it's itchy, then allergy may play a role.
And so what do? You go to the doctor and.
Yeah, if you try to figure out if it's the hereditary angioedema, and there's some medications that can be given. Big thing is it a side effect of your blood pressure medicine or your heart thing?
ACE inhibitors.
Because that's the most common.
So we just got a question. How about lisinopril, or, like you just talked about, or an ACE inhibitor associated with eosinophilic esophagitis? We just talked about that too. Do you see that combination?
I guess it would be potential. It's pretty unlikely though. That would be more just with a drug allergy.
Okay. And the most common cause of eosinophilic esophagitis, once again, is food.
Milk.
Oh, it's milk.
Yep, that's number one.
No kidding. And the next is shellfish?
Nope, it would be egg and wheat.
So then after that is shellfish.
Yeah, here we don't eat a lot of shellfish, so it'll be soy or peanut butter.
Okay.
This is South Dakota. We want our beef and pork and chicken.
And then it shows.
And it can be actually the beef, pork, chicken.
So I had a guy who I thought had eczema, and he said, "But boy, I don't have this problem, except when I'm preparing shrimp at the pub that I'm working at." And so I told him he can't prepare shrimp anymore.
Yep, and it fixed it, didn't it?
It solved the problem. 64-year-old person currently living in Sioux Falls, grew up on farms, lived in large cities as well. About 5 or so years ago, I started experiencing allergy symptoms in the spring and the fall. Why did they start later in life? 64.
Allergies are something that can start at any age. And you just feel lucky when you don't have them for most of your life.
Okay, so it's just the luck of the draw.
Yeah.
I mean, something sensitized you.
Just the wrong exposures, infections, the way your genetics interacted with environment.
Yeah. Okay. I have Samter's triad. I don't know what that is.
So that will be nasal polyps, asthma, and when you have aspirin you have a horrible asthma attack.
Okay.
And it causes the polyps to grow.
I didn't know that was Samter's triad. But Samter's triad, I want to know something about biochemical process that caused aspirin allergy, which came on dramatically 12 years ago. He's 74. That's interesting. Came on when he was 62.
So cyclooxygenase isn't working right, and it shunts a bunch of the reactive substances the wrong way, and voila, you're sick as could be. It's not really an allergy. It's actually a biochemical problem with enzymes.
Wow.
And for some people who are having a lot of problems, we desensitize you to the aspirin. You start at a teeny dose of aspirin type of stuff that we squirt up your nose. Squirt some more and some more. It's a 2-day process, and it can slow down the growth of your polyps. And it can help out with the severity of your asthma.
All the people with asthma and polyps have this?
No.
Okay, so polyps can occur anyway.
And not be related to the other stuff.
Not be related at all. Are plugged up ears an indicator of allergies?
Occasionally. You'd have to have itchy, sneezy nose too most of the time.
Okay, 30 seconds. 86-year-old woman from Sioux Falls. I'm allergic to an opium-based drug. Tell me what this means. Any opium-based.
Opium or those type of narcotic drugs are direct stimulants to fire off mast cells, and that's if it's to all of them, that's probably the mechanism.
All right. Well, I think that's it for now. For the winner of tonight's Prairie Doc quiz question, one ragweed plant can produce how many pollen grains in a season? 100, 5,000, 1 million, 1 billion? The correct answer is D, 1 billion. It was Wayne Fouth from Brookings who answered the question correctly. Thank you, Wayne, for participating, and a book will be in the mail to you soon. Mark, if one plant makes 1 billion pollen grains, how many pollen grains does it take to screw in a light bulb? No. How many pollen grains does it take to cause an allergic reaction? So, I mean, one plant makes 1 billion. Mm-hmm. How many pollen grains do I need?
Just a few. And you know, with ragweed, what's amazing is they've done studies, and 400 miles out to sea, you can still find ragweed pollens.
400 miles out to sea,
yeah.
And people still have an allergic reaction.
Yeah.
Wow.
So you don't have to be standing right next to that ragweed.
It's really, but if I'm exposed to a ton of them, is it going to be a worse allergy?
Yeah.
So it's exposure.
Dose dependent, you know, a lower dose. That's why closing your house up, run the air conditioner, helps decrease your symptoms some.
Some.
Yeah.
And not completely. All right. We'll be right back after this.
As your baby grows, there are new surprises and adventures every day. With each new milestone, remember, immunizations are safe and one of the best ways to protect against serious diseases, especially between birth and age 5.
Now that my grandson Henry has reached his first birthday and our granddaughter Stella has arrived, we're making sure that they stay on their immunization schedules.
Schedule your children's immunizations today, for baby's sake.
His rash was itchy, raised, red, blistery, and distributed in streaks along both forearms. Likely this was from poison ivy, especially since he had been camping and hunting for firewood in a woody area that weekend. Although it was too early in the spring to see the groups of 3 glossy, pointy-leaved plants, He had been pulling on furry, rope-like woody vines, probably the winter vine form of the poison plant. Allergists and dermatologists call the rash from poison ivy a form of contact dermatitis, which is an allergic reaction to the oil of the plant. First exposure to the poisonous oil is the sensitizing dose and generally doesn't cause a rash. The next exposure, however, brings on the allergic eruption. 85% of adults have been sensitized to poison ivy sometime in the past. Many other agents can also cause contact dermatitis, but rarely so violent as from the oil of poison ivy. About 15% of us react to nickel, which is characterized by a dry, scaly rash, hives, or blisters distributed on earlobes, around the necklaces, or under wristwatches. Other allergic contact culprits include latex used in shoes and gloves, juice off of clams, oysters, and shrimp, perfumes blended with cosmetics, nail polish, and skincare products, sticky adhesives used on tape, false eyelashes, and toupees, and antibiotics found in Neosporin, Bactroban, and triple antibiotic ointments. Other forms of contact dermatitis are not allergy-driven and happen because the agent is frankly toxic, like bleach, kerosene, battery acid, and cement. Also irritating is when there is excessive wetness, washing, and detergents. Another kind of contact dermatitis follows the combination of sun exposure and certain perfumes, insecticides, and oil from the skin of a lime. Of course, treatment depends somewhat on the specific agent that causes the problem. Cleansing the allergen away might be important. Protecting with barrier creams and ointments like zinc oxide or CeraVe might help. Sometimes oral, not topical, antihistamines help, like Zyrtec or Allegra tablets daily, but not Benadryl lotion. Normally, however, topical steroids like cortisone or triamcinolone cream are needed to turn off inflammation. And when the reaction is severe enough, a tablet or injectable form of steroid might be prescribed by your doctor. The most important lesson should be avoiding the allergic or toxic agents in the first place. My poison ivy patient was careful when he was in the woods from that day forward, especially when encountering furry, rope-like woody vines. Well, a big thank you to our guest, Dr. Mark Bubak. It's always a good show when he volunteers to come on the studio, and also he's on our board of directors, and we appreciate his time and effort, and thank you so much for all your help there. Viewers have asked if there's a way to get a copy of the book, The Picture of Health, besides winning the quiz question. Go to our website, prairiedoc.org, and click on the donate button, and there you may join in and help by underwriting our efforts for honest, science-based public health education. Please follow the directions there and send in your deductible gift to Healing Words Foundation. For gifts of $100 or more, I'll send you a personalized, autographed copy. Thank you in advance for your generosity and support of these efforts to improve the lives of viewers like you. This will be the last live show that I will host this season. Next week, an old friend, Lindsay Myers, will host, and then we have several new shows that were previously recorded to finish out our 14th season. We have already begun planning and preparing for next season. Our topics and guests are being lined up, and we hope that you'll invite us into your homes again in the fall. And I humbly thank you, our viewer friends, for all your support over the years. It means a lot to know that you're out there. That does it for tonight from all of us here at On Call with the Prairie Doc. Until next time, stay healthy out there, people.
receive a diagnosis of cancer, you know your life is going to change. Some of those changes affect you physically and emotionally. Breast cancer. Next time on Call with the Prairie Doc.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
LARSON Manufacturing is proud to support on-call television as it continues to open doors for important medical information.
and by the South Dakota Foundation for Medical Care, an organization working with the state's healthcare community to improve quality of care as part of the Great Plains Quality Innovation Network. Additional funding is provided by Allergy Asthma and Allergy, Avera Heart Hospital, Brookings Health System, Dakota Allergy and Asthma, Dakota Care, Orthopedic Institute, Physicians Care, Sanford Clinic Community Service Committee, South Dakota State Medical Association, SwiftTel Communications, and Vance Thompson Vision. Closed captioning for On Call with the Prairie Doc is provided by Avera, Brookings Health System, and Fishback Financial Corporation.
Hello and welcome to On Call with the Prairie Doc After Hours. We had many great questions submitted beyond what we could answer during the broadcast portion of our show, so let's get started. We have a caller, a 71-year-old woman from Sioux Falls, asked her daughter had no allergies until she moved to West Virginia when she was 10. She went for a walk and barely made it home in the winter because of wheezing. Winter. Exercise-induced asthma was diagnosed. What causes wheezing? Now, I mean, think one thing, cold, winter, and then there's this snow allergy, snow fungus. So let's talk about both of those.
But probably, that type of a scenario would be that a person at that age just starts to become, we'll say, asthmatic.
Yeah.
And when you get out, exercise plus cold air, that's a double whammy for triggering asthma. And that would push somebody that is kind of borderline and doing okay slow to all of a sudden, oh man, this really kicked in.
Yeah, she probably had some asthma before that, don't you think?
That's the usual case.
Yeah. Now let's talk, that's brought up snow. And a big thing that we talked about, David Graper and I talked about yesterday on the radio, was snow fungus that melts in the spring, and that can be a big allergen. Do you see a lot of that, or you don't think that's a big deal?
I suppose, the mold spores have been sitting there, and then all of a sudden they dry out and they can blow.
Right.
So it's kind of a special present for the spring that's been saving up. But a lot of people talk about that. I also worry, though, that it's not so much the mold, it's the viruses people are catching at that time of year, because that, early March, the cold and flu season is rampant. Yeah. Influenza and all that.
It's interesting that this year influenza peaked in March. I couldn't believe it. An 83-year-old woman from Sioux Falls asks, husband died of esophageal cancer, used an over-the-counter 4-way nasal decongestant in the spring due to allergies. Active ingredient was phenylephrine hydrochloride, 1%. This undoubtedly went down his throat and makes me suspicious of this causing cancer. Could it have caused it? Well, what is your comment about nasal spray, 4-way nasal spray, and all those things? Afrin-like.
Yeah, the 4-way nasal spray is really handy to be used for a short period of time to help keep a person open. But beyond that, you can start having some problems. So it's a temporary help. I guess I'm not aware of any cancer links with that.
Yeah, my take on the Afrin-like nasal sprays like this is that I give my patients permission to use them once a week. I mean, you're a little bit more liberal apparently, but they get hooked.
5 days, and then you got to stop for a while.
You can be hooked on it. I mean, it irritates so that now you've got a problem related to the nasal spray. We have another question from. I don't know anything.
I don't know
about
of
cancer.
anything that way.
And I don't think anybody knows an answer there for her on that. Is it true that Siamese cats are non-allergic?
It is not correct.
That's not correct.
They are allergenic. There is no such thing as a non-allergenic dog unless it's or cat. There's no hypoallergenic cat. There's no hypoallergenic dogs. There have been some neat studies. The dog one came out a few years ago, and it said that the measurements of how much dander was coming off these dogs was at least as bad as the highly allergenic dogs.
Really?
And so what you'll see actually is that even within the same litter of kitties or puppies, you're going to have up to an 8 times difference in how much dander is coming off. With cats, it's a little easier too. Male cats just put out a lot more dander
than the
allergen than females, but it's individual critter to critter variance.
Really? But we went Maltese because we heard of hypoallergenic.
Great marketing.
What about poodles? I've heard poodles low.
Poodles are nice because they don't shed.
Right.
But
the non-shedding thing.
It's just the hair doesn't fall off. It doesn't mean that the dander isn't falling off.
Okay.
Yeah.
So you don't believe in the difference. So Siamese cat, send it to grandma. Man from Custer asks, can allergies be caused by chemical exposure? My wife flagged down crop dusters as a job, and now she has severe allergies. Have you heard that one?
You know, the fertilizers and those type of chemicals are actually too small to make the regular itchy, sneezy, hay fever type of things. And they'll cause more problems directly because of just what they are. And if you are one that's developing asthma, they can sure be irritating.
And trigger asthma when you're exposed.
When you're getting sprayed.
But it shouldn't set you up for allergies.
Doesn't really seem to.
But when you're standing out in a field day after day, that might trigger your
I think you have to be a little careful.
Yeah, here it is. Well, I'm thinking about the sensitization that you can be when you're outside in the field. But, gee, you know, everybody's different. But you don't think the chemicals in the crop duster had anything to do with it?
It'd be a hard press to say yes on that one.
Okay.
Yeah.
After our question, 69-year-old woman from Laverne, Minnesota asks, just diagnosed with macular degeneration and was prescribed an eye supplement vitamin and said she also needed multiple vitamins. Is it necessary or would it be harmful for her to take the multiple vitamin along with the eye supplement vitamin? Do you have any opinions on that?
Neither is an allergy question.
They aren't. I have an opinion, though.
I think you should take this.
I did this. I looked at the data that said that the ingredients in the multiple vitamins that have been touted, the zinc, and there's another ingredient I'm blocking on the name that's so important. But they're only when it's severe wet macular degeneration. In the meantime, most of the ophthalmologists and optometrists are suggesting supplements just in case, but the data is real weak.
Okay.
And my personal opinion is if you do a multiple vitamin, it has some zinc in it, you don't want to over zinc yourself. And the people who did the study are the people who were selling that particular Bausch and Lomb supplement. So not to say that it's...
Do you think with veggies and fruits that a person can do a decent job with supplementing?
Actually, I think that if a person ate a balanced diet, had nuts, mixed nuts, not peanuts, you're going to get a lot of those minerals that you need, and you eat fruits and vegetables, and you're going to get all those good things. So I think we've gotten an idea that we need a pill, and I think they've overdone the pill thing. So, well, we thank you for joining us on our website. We appreciate all your questions and the opportunity to answer them. And until next time, from all of us at On Call with the Prairie Doc, stay healthy out there, people.